Hello again, it's Dr. Jim. Thank you so much for stopping by. I would like to talk about some of the benefits associated with the liberalized diet. Most senior care centers across the country have endorsed the philosophies of person-centered care, which is great. And as well, the liberalized diet that person-centered care promotes. The days of medical and therapeutic diets low in fat, salt, sugar, carbohydrates, and starches are long gone for the most part and have been replaced by highly individualized food preferences. Now, it is not rocket science to imagine that if seniors are in control of their diet and they have the ability to choose what they want to eat within reason, they will experience better health outcomes, better quality of life, and greater benefits beyond those, which are so much better than malnutrition. So, what's wrong with therapeutic diets? I'm not here to put them down. I'm just here to compare. For decades, therapeutic diets have been prescribed to manage age-related diseases and health problems like heart disease and diabetes. While they may have been a healthy option in theory, a negative side effect was malnutrition due to overly bland and tasteless food. The food was not yummy. It wasn't appealing. These diets were simply too restrictive and limiting and brought no joy to mealtimes. Therapeutic diets are also modified for nutrients and textures, food allergies, and food intolerances. So, the benefits of this diet were simply grossly outweighed by the high costs of malnutrition and poor quality of life for far too many seniors and for far too long. So there's a mantra, there's a saying, there's a way of thinking. Change the meds, not the food. Or tweak the meds and leave food alone. So, a tough lesson learned through the prescribing of therapeutic diets is that they simply missed their mark. While attempting to better control disease conditions, they actually made matters worse. In addition, many therapeutic diets have failed to provide measurable health benefits with the senior population residing in skilled nursing centers. Not enough evidence that said those therapeutic diets really worked. So because of this, leaders in senior care now know that it is preferable to make modifications to medications rather than taking away the joy of eating. So diabetics, for example, may be able to eat more of what they really do prefer and like and get the nutritional value of that food with simple adjustments to their medications, okay? So let's look at some of the benefits of the liberalized diet. While there are numerous benefits associated with this diet, the risk of malnutrition has got to be one of the most important ones. It's well known that malnutrition is common in senior care and for a number of reasons. Frailty, cognitive problems, memory problems, declining health, comorbidities. It's a tough thing to provide good, nutritious food to very ill, cognitively impaired, declining older adults. Overly strict diets, though, are among the leading causes of malnutrition in senior care. Food not eaten is healthy for no one. Isn't that so simple? Here's a really great therapeutic meal, but no one eats it. what good is it? So, food not eaten is healthy for no one and is associated with unintentional weight loss and risk of malnutrition. So, improved quality of living is what we're really talking about. Eating what one wants, where one wants, and what time of day all matter. Chances are, foods that are appealing and delicious will be eaten more than foods lacking in taste, color, or excitement. The liberalized diet brings joy back to the dining room table. Meals are an experience, and the food, as well as the company, might be the highlight of the senior's day. And we should always remember that. My final thoughts. It took a while to change the way diet and nutrition are viewed in senior care. Once, therapeutic diets were believed to be the best option for maintaining health, but they came with a heavy price, that of malnutrition and decreased quality of life. The liberalized diet has many benefits for senior living, and the food is what they want to enjoy. It's the food that they want, that they prefer. It tastes better. Meal times are more exciting. They eat what they want to. Health outcomes appear to be better as well. For example, better skin integrity and fewer pressure ulcers are associated with liberalized diets. This diet can even save money, since great food is chosen over expensive liquid supplements. And I could go on and on and on with benefits of liberalized diets, but at least I wanted to give you that much in this short video. Thank you for watching. I appreciate it. I'm Dr. Jim Collins. Keep coming back for more information because I always have something to say.